Greetings, Dr. Raj, the sexologist. As we age, we would like to perform sexually as we were when we were younger. Unfortunately, most of us don't take care of our sexual health. We don't take care of our health generally. So, the dilemma with most persons who are over the age of 40, 45 is they want to perform as they used to when they were 18 to 25, but that's impossible. You see, there are many factors that will affect the way a person behaves sexually and the way a person operates sexually as you get older. But what do you do when you are much older, in your 50s plus, 60s, 70s plus, and you want to maintain a good sexual life? You want to be able to perform sexually, but you don't have the wherewithal to do that. That's where Dr. Raj and the Adult Therapy Center comes in. We are located in St. Augustine, Chaguanas, Debe, Princestown, and we deal with all sorts of sexual dysfunction for male and female. The aging process is something that is a deterrent for individuals to perform sexually as they used to in the past. So what do you need to do? You need to work on that. You need to make sure that you have good sexual health. But of course, sometimes we have some sort of lifestyle disease, diabetes, hypertension, high cholesterol, other ailments, and injury. Sometimes the relationship you have with your partner does not encourage you to perform well sexually. That also is a deterrent. Sometimes there's an incompatibility in your relationship. As you age, you need more to stimulate you, to stimulate your mind, to stimulate your body to perform sexually. When you're younger, as they say, if the wind blow hard, you'll get an erection. Some women get easily aroused. But as you age, with all the experiences you have had throughout your life, that makes it a little more difficult for you to be aroused or to perform sexually. And you know, there are the exception to the rule, so somebody will be throwing up their hands and say, that doesn't apply to me. Fine. But for 90% of the population, it applies to them. 90% of the aging population, it applies to us. I am 61, so I can tell you, I deal with clients over the age of 50 all the time. It doesn't mean to say young people don't have sexual dysfunction, but I'm dealing with the older generation here, those who need the help to overcome their disability sexually. And it is a disability, but it's something that can be fixed. The minute you use the word impotent, or I shouldn't be having sex now because I've crossed a certain age, because of religious or societal issues, you might tell yourself, well, hey, I don't need sex anymore. But you do have feelings, and you might be in a relationship where you have to perform with your partner, where you have to give in to certain things sexually. So what do? Just give up? No. What you need to do is to make sure you're able to perform, make sure you're able to live. Because a good quality of life for any individual includes a good sexual life. The ability to perform. You may not be able to perform once or twice a day as you used to in your youth, but you can perform maybe once a month. Very good. If you are able to do the things that you're supposed to do. Most persons don't pay heed, they don't pay attention to their sexual health. Therefore, they end up in a lot of problems sexually, mentally, emotionally, because let's face it, if you're not having sex, if you're not taking care of that sexual need, you are going to become a bitter person. You are going to be frustrated. You'll have anxiety, you'll have anxiousness, you'll have so many different things that are going to affect your mind. And when it affects your mind, it's going to affect your body. When it affects your body, it's going to affect your performance in everything that you do. So good sexual health is something that is very important for the aging population. Do we pay enough attention to it? No, we don't. So what do we need to do now? We need to find a way to fix your sexual health. That's why you should get in contact with me at 645-4543, 285-9739. Get in contact with me and I will be able to assist you. My personal phone number is 740-1961. Dr. Raj here. Take care.